Unfortunately, mental, neurological, and substance disorders do not receive the attention they require. This neglect results in a big gap between need and available services, especially in resource-constrained settings of low and middle-income countries. For example, a study conducted by the WHO suggests that up to 75% of persons in need of mental health services do not get the care they deserve in these countries. In Nigeria, as in most sub-Saharan African countries, there is a gross shortage of mental health specialists. For example, the country has about 1 psychiatrist to 1 million people, a poor comparison to a ratio of about 1 psychiatrist to 50,000 people in countries in Europe. In addition, most of the available specialist human resources in the country are based in a few urban centers, leaving the vast majority of the country's community with no specialist service. It is therefore no surprise that studies conducted in the country have found that only 20% of persons with common but serious mental disorders, such as depression with suicidal risk, have received any treatment in the previous 12 months. Among those who did, only 10% received what can be regarded as minimally adequate treatment. Studies have also shown that it often takes an average of 6 years for persons who eventually get treatment to do so from the time of illness onset. It is generally agreed that the best way to bridge the gap between need for mental health care and available service is to integrate the care of mental disorder into primary care. By definition, primary care is expected to offer first contact, comprehensive, continuous, and coordinated service to persons with various health conditions, including those with mental disorders. However, this expectation is hardly achieved in primary care service in Nigeria. The reasons include inadequate training of primary care providers, leading to poor recognition and inappropriate treatment of mental health conditions, absence of support and supervision for their work, uncoordinated referral pathway through the various tiers of the health services, and policy neglect that commonly manifests in the form of poor funding and irregular supply of medication for mental, neurological, and substance use disorders.